Systems framework. Systems consist of a set of interrelated and interdependent components designed to achieve some common goals. So the systems framework explains the structure of healthcare services in the United States based on the foundations. It provides a logical arrangement of various components. It demonstrates a progression from inputs to outputs. So I'm going to explain this a bit later in a chart format. So the framework outlines what you see in figure 1.5, environment, system features, and future trends. So under environment is system foundations. Under system features, they look at system resources, system processes, and system outcomes. In the future trends, they look at system outlook. Systems framework from the textbook figure 1.5. So remember how we said the system framework is divided into environment, system features, and future trends. So let's look at environment first. So environment has the system foundations. So what are your foundations? When you think about it, it's your cultural beliefs, your values, and historical developments, like the history of things. How did it all started? So you'll see that more in chapter 2. Foundations of U.S. healthcare delivery, and Chapter 3, Historical Overview of U.S. Healthcare Delivery. And after that, you start understanding more the system features, which has the resources, processes, and outcomes. So when you look at resources, you're thinking about human resources, which you see in Chapter 4, Healthcare Providers and Professionals. Who are your healthcare providers? Who's helping you? Who's there to provide services for you? Non-human resources would be Chapter 5, Technology and its effects. How does technology help you with your healthcare needs? Chapter 6, Financing and reimbursement methods. You know, money does talk. So system processes is the continuum of care. So you'll see that in Chapter 7, Outpatient Services and Primary Care. Care that you receive continuously. It could even be annually. Chapter 8, hospitals. When you go to a hospital, you're not going to like, okay, day 1, we give you some care. Day 2, oh, no care. Oh, day 3, there's care. It's continuous care. Chapter 9, managed care and integrated system. Remember how I mentioned an integrated system? Under managed care, different professions come together and talk about a patient, usually one that is high risk, and think of ways to solve it and to help the patient get better. Special population. Chapter 10, long-term care services. They're usually the elderly, the disabled. Chapter 11, population with special health needs, our vulnerable group. System outcomes, issues and concerns. What do we care about? In Chapter 12, costs, access. Are you able to access healthcare? And the quality. Are you getting good care? Or just like, change and reform. How do we change healthcare? We create policies. Like Chapter 13 is about health policies. We create policies. And how would that improve the health of the individual, the community, the society? Future trends is the system outlook, the future of health services. Chapter 4, how is this all going to look? Again, the system framework is the system foundation, is the structure of the current healthcare system is not random, but it can be explained by historical, cultural, social, and economic factors, how the healthcare started. These factors affect both forces shaping new trends and developments and these impending change. So when health insurance started around World War II, the way it has progressed, the way it has changed from then to now, what we have today is very different from when it started and why it started. System resources, both human and non-human resources, are essential for healthcare delivery. The human resource consists of the various types of workers directed, engaged in the delivery of health care to patients, such as healthcare professionals who have direct patient contact, like doctors, nurses, dietitians, social workers. These are all healthcare workers. And technicians. Technicians are also very important. They help a lot too. It could be a dietetic technician. It could be a radiologist technician, sonogram technician, etc. There are also numerous ancillary workers who are important but indirectly supportive roles, such as the administrative work, to make sure things are running smoothly. And we also have to remember technology is also part of it too, because technology helps a person breathe, the heartbeat, check blood pressure, sonogram. These machines are also very important. System processes carry out mainly through the healthcare delivery infrastructure, such as hospitals, clinics, long-term care providers. The managed care organizations are responsible for actual healthcare delivery, apart from their role in financing, insurance, and payment. Integrated systems deliver a range of healthcare services. Remember the integrated group, the different health professionals that are talking together. Special institutional and community-based settings have been developed for long-term care and mental health, and healthcare infrastructure must also support and accommodate special populations. System outcomes refer to critical issues and concerns surrounding what the health services system is able or unable to accomplish with regards to its primate objective, which is cost-effective health services that meet the U.S. quality standards. So you want to make sure you use your money to the best of its ability and still maintain quality. Access, cost, quality are the main outcome criteria for evaluating a health delivery system. So are people getting health care? And what's the cost of it? Are they overpaying too? Issues and concerns regarding these criteria can lead to initiatives for system reform through health policies. And a lot of times, health policy is done through government. How are they going to change it for the future? System outlook. Dynamic healthcare systems must look forward and consider future outcomes in the context of social, cultural, economic, and other forces. So you're looking into the future for this. What are we expecting in the future? How would things change? The conclusion is the United States has a unique system of healthcare delivery. Its continuous and comprehensive care is not enjoyed by all Americans, so not everyone likes the way our healthcare system is. It's a patchwork of subsystems. No country has a perfect system, even though they may be number 1, 2, or 3 in the world. The systems framework is an organized approach to understanding the components of the U.S. healthcare delivery system. See you soon. Remember to read the book.